Hello friends, welcome to Triya's Pediatric Online, continuing with the series of inborn error of metabolism. In today's video, we are going to learn phenylketonuria. So let's start with the question. Just think, true statement regarding a 3 weeks old child with phenylketonuria is all except ferric chloride test helps in diagnosis. Tyrosine become an essential amino acid in diet. Serum phenylalanine level increased as well as urine phenylpyruvate level is also increased. Phenylalanine should be completely stopped in diet. What do you think? What could be the wrong statement for phenylketonuria for a child who is 3 weeks old? Wondering? To know the answer, please do not skip anything. Watch the video till the end. So let us learn phenylketonuria in a very simple and smart way, because on this platform we don't do hard work but we learn through smart work. Hi, I am Dr. Triya Nimalde, pediatrician and consultant neonatologist. I'll be your guide for pediatric subject. If you are new to my channel, please do subscribe and give like to this video. So let's start with the question. A normal born child presents with mental retardation, blonde hair and convulsion at the age of 1 year. This condition is caused by the deficiency of options are phenylalanine hydroxylase, tyrosine hydroxylase, tyrosinase, or is it homogentisic acid? We know the highest possibility looking at the symptoms could be the phenylalanine hydroxylase, but what about these three? So what about option B, C and D? Now, tyrosine hydroxylase deficiency is a rare genetic disorder which is characterized by a wide spectrum of symptoms such as abnormal gait and dystonia. And this enzyme helps convert the protein building block tyrosine to a catecholamine dopamine. So this option is not correct. Symptoms do not match to this enzyme deficiency. Now tyrosinase deficiency will cause decreased skin and retinal pigmentation, and it will cause increase in risk of skin cancer and considerable vision loss. So this option is also out. Now what about option D? Homogentisic acid deficiency. Actually it is homogentisic acid oxidase deficiency, and that condition is known as a alkaptonuria. So here the correct option is phenylalanine hydroxylase. Now let's learn about phenylalanine. Phenylalanine is an essential amino acid. It is normally degraded by tyrosine pathway, and phenylalanine along with tyrosine precursor amino acids for important compound like thyroid hormone, neurotransmitters as well as melanin. This is the phenylalanine metabolic pathway. In absence of phenylalanine hydroxylase, it blocks the transformation of phenylalanine to tyrosine. So it will give rise to two problems. There will be increase in phenylalanine, and unmetabolized phenylalanine is shunted into pathway that lead to formation of phenylketones like phenylpyruvic acid, phenylacetic acid and phenylactic acid. And these compounds are responsible for musty odor of urine and body. Reduced tyrosine will lead to reduced production of melanin, other proteins and dopamine, and this is responsible for reduced pigmentation, hair, skin and eyes. Phenylketonuria caused by mutated gene for phenylalanine hydroxylase, and this gene is located on chromosome 12. Phenylketonuria is inherited in families in an autosomal recessive pattern. Autosomal recessive inheritance means that affected individual have two copies of the gene that is altered. This only occurs both parents are carrier for PKU. Usually, each parent of an affected individual carries one copy of altered gene. Since each parent also has a normal gene, they do not have signs or symptoms of phenylketonuria. There is 1 in 4 chance to have a child with phenylketonuria in each pregnancy, as well as 1 in 4 chance to have a child who is completely unaffected, and 1 in 2 chance of having carrier children. Let's solve another question. Mousy odor of urine is seen in which condition? Your options are tyrosinemia, galactosemia, alkaptonuria, or is it phenylketonuria? So we all know, because just now we have learned that in phenylketonuria we have musty or mousy odor of urine. So correct option is phenylketonuria. But what about this rest 3 condition? So in phenylketonuria we have to remember this flashcard. Here there will be a mousy odor of urine, reduced pigmentation and neurological symptoms, and there will be a deficiency of phenylalanine hydroxylase. What about tyrosinemia? To remember this condition, we have to remember tire of cab because it is a tyrosinemia. Just remember, there is a tire of a cab. There will be a cabbage-like order of Phenylketonuria is called black bone disease. So here there will be a black color of urine. So this two condition is easy to remember. So what could be the symptoms presentation of phenylketonuria? Newborn with phenylketonuria appears normal at birth. Many of them might have blue eyes, fairer skin than other family members. Early symptoms could be vomiting, irritability, eczema-like rash, musty odor of urine and body, increased tone, and increased deep tendon reflexes. Later, severe neurological problems in the form of intellectual disability, seizures, hyperactivity, as well as autistic-like behavior. Next question. Typical order of urine in PKU is due to the presence of fumarate, phenylalanine, tyrosine, or is it phenylacetic acid? Just now we have learned that phenylalanine metabolites are increased in urine and acetic acid is one of the metabolite and it is responsible for musty odor of urine. So here the correct answer is phenylacetic acid. Which of the following is not a feature of phenylketonuria? Severe mental retardation, reduced tendon reflexes, enamel hypoplasia, vomiting in early infancy. If you remember the previous slide, mental retardation or intellectual deficit, yes. Reduced tendon reflexes, it will have increased tendon reflexes as well as increased tone. Enamel hypoplasia, yes. And the presentation could be in the form of vomiting in early infancy. So here the correct answer is B, reduced tendon reflexes. That is not a feature of phenylketonuria. So here again one more flashcard for you to remember. Just have a look. It will have a symptoms of CNS in the form of seizures, microcephaly, hypertonia, increased reflexes, irritability, mental retardation as well as growth retardation. And this is because of metabolism is shifted to alternate pathway. Brain cells are deprived of amino acids. Those are essential for myelination and maturation. Light complexion is because of absence of tyrosine and reduced melanin. Poor development of tooth enamel and decreased physical growth is also a feature of phenylketonuria. Next question. True statement regarding phenylketonuria. Our options are urine phenylalanine metabolites are increased, deficiency of tyrosine hydroxylase, serum tyrosine levels are increased, symptoms are present at birth. See, first option, urine phenylalanine metabolites are increased. Yes, this is correct. Option B, deficiency of tyrosine hydroxylase. No, there is a deficiency of phenylalanine hydroxylase. Serum tyrosine level reduced, it is not increased. Symptoms are present at birth. No, newborns are asymptomatic at the time of birth. So correct answer is option A. The next question is, Guthreries test can be used for the diagnosis of tyrosinemia, glycogen storage disease, alkaptonuria, or is it phenylketonuria? Tyrosinemia will have increased tyrosine in urine. GST, there are different set of investigation for the diagnosis. Alkaptonuria, gas chromatography and DNA analysis is the choice of diagnosis, while phenylketonuria is the correct option. And now let's learn about Guthreries test. There is a mnemonic to remember the condition which can give positive Guthreries test. Guthreries card can help predict bad metabolism. G stands for galactosemia, C stands for cystic fibrosis, another C stands for congenital adrenal hypoplasia, H stands for hypothyroidism, P stands for phenylketonuria, B stands for biotinidase deficiency, and M stands for MSUD. These are the conditions in which we can have a positive Guthreries test. So what is Guthreries test? This test determines phenylalanine level in the blood and it should be done on the second and third day of life. It is a screening test done to identify elevated level of phenylalanine and it is not the diagnostic. In phenylketonuria, the baby's phenylalanine level is usually 20 to 40 mg per deciliter in comparison with normal level of 4 to 6 mg per deciliter. So how it works? Blood on the filter paper is placed on the agar plate with a strain of Bacillus subtilis that require phenylalanine to grow. The presence of growth is indicated by halo surrounding the filter paper. If this test is positive, blood phenylalanine as well as tyrosine levels are determined. If this is also elevated, a confirmatory assay for phenylalanine hydroxylase is to be done. In Western country, The blood is screened for phenylalanine level for all newborn under neonatal screening program. Usually, few drops of blood are obtained by small prick on the hill, placed on a card and then sent for the measurement. If screening test is abnormal, as we discussed, other tests are needed to confirm or exclude the phenylketonuria. Newborn screening allows early identification and early implementation of treatment. The another test is ferric chloride test. So in phenylketonuria, ferric chloride test with urine gives which color? Is it green, blue, red or purple? This has to be remembered. There is no other option. So the correct answer here is green. Approximately 10 ml of urine is taken with the 3 to 4 drops of 10% ferric chloride. If the patient is suffering from phenylketonuria because of presence of phenylpyruvic acid, the urine will turn in bluish green color. This test could be positive in the few of the condition. It could turn in a green color in case of tyrosinemia because of presence of hydroxyphenylpyruvate, turn to blue-black color in case of alkaptonuria due to presence of homogentic acid. It will turn red in decay in diabetic ketoacidosis because of presence of acetoacetic acid, and it will turn to purple in case of 3-oxothiolase deficiency due to presence of ketones. What are the treatment options of phenylketonuria? It could be divided in medical management and nutritional management. In a medical management, oral administration of tetrahydrobiopterin, which is cofactor in oxidation of phenylalanine, is a good potential. Second treatment option is nutritional management. The goal of treatment is to maintain the blood phenylalanine level between 2 to 10 mg per deciliter because some phenylalanine is required for normal growth, and this requires a diet that has some phenylalanine but in much lower level than normal. So here is our question which we discussed in the starting of video. True statement regarding 3 weeks old child with PKU is all except ferric chloride test helps in diagnosis. Tyrosine becomes an essential amino acid in diet. Serum phenylalanine as well as urine phenylpyruvate increased, and phenylalanine should be completely stopped in diet. First 3 statements are correct because just now we have discussed it. But this statement is incorrect because very low or absent phenylalanine can cause mental and physical sluggishness, loss of appetite, anemia, rashes and diarrhea. It should not be completely eliminated, rather it should be restricted. So the second option is treatment option in nutritional management. The patient who is suffering from phenylketonuria should avoid foods like meat, fish, poultry, eggs, cheese, milk products, dried bean and peas. Can be given is measured amount of cereals, starches, fruits and vegetable along with milk substitutes, as well as there are availability of phenylalanine free formulas for all age groups. The next question, a child of phenylketonuric mother may develop. Options are microcephaly, mental retardation and congenital heart disease. Mental retardation, cataract, congenital heart disease. Option C, hydrocephalus and cataract. Option D, microcephaly, cataract and renal dysplasia. Here just remember the answer, it's a first. We are going to learn in detail in the subsequent slides. Here the option A is correct, that is known as a mnemonic MMC, microcephaly, MR and congenital heart disease. Women who have phenylketonuria and become pregnant are at risk of another form of condition which is called maternal phenylketonuria. If women don't follow the special PKU diet before and during pregnancy, blood phenylalanine levels can become very high and harm the developing fetus or can cause miscarriage. So complication at birth may include MR, microcephaly, cardiac defect, low birth weight, delayed development and behavioral problems. So you can remember, just now we have discussed, you can remember as MMC. So that's all about today's video. I hope you all learned well and understood well. Please let me know what other topics you would like to learn from me. Till that time, take care of yourself, study hard, study smart. Bye.